After the age of 40, joint discomfort begins to feel more noticeable for many people. It rarely appears overnight. Instead, it develops gradually. A slight stiffness in the knees when climbing stairs. A tight sensation in the hips after sitting too long. A dull ache in the lower back at the end of the day. Shoulders that no longer move as freely as they once did. Fingers that feel swollen or rigid in the morning. Most people assume this is simply the cost of getting older, but aging alone does not automatically cause painful joints. What changes after 40 is the balance between stress and recovery. Over the years, small mechanical loads accumulate. Muscles weaken. Connective tissues lose elasticity. Recovery slows. Inflammation increases. The body becomes less forgiving of repetitive patterns. Modern lifestyle accelerates this process. Many adults spend large portions of the day sitting. Sitting shortens hip flexors, weakens glutes, tightens hamstrings, and reduces spinal mobility. When these imbalances persist for years, joints begin absorbing forces they were never designed to handle alone. Joints depend on surrounding muscles for stability. When muscle mass declines with age, joints lose their protective support. This decline begins subtly in the 30s and accelerates in the 40s. Without regular resistance training, muscle fibers shrink. Less muscle means less shock absorption. The knee joint, for example, relies on strong quadriceps and hamstrings to distribute load evenly. When those muscles weaken, the joint surface bears more stress. The same pattern applies to shoulders and the spine. Another factor is collagen quality. Collagen provides structure to ligaments and tendons. After 40, collagen production decreases, and existing fibers become stiffer. Reduced elasticity means tissues do not absorb force as efficiently. This contributes to stiffness and vulnerability. Hormonal shifts amplify these changes. Estrogen helps maintain connective tissue flexibility. Testosterone supports muscle repair. Growth hormone aids tissue regeneration. As these hormones gradually decline, recovery becomes slower. Sleep also plays a crucial role. Deep sleep is when growth hormone peaks and tissue repair accelerates. Many adults over 40 experience lighter sleep with more awakenings. Even if total sleep time remains similar, reduced deep sleep means incomplete repair of small micro tears from daily activity. Inflammation quietly increases during midlife as well. Chronic low-grade inflammation can stem from stress, processed foods, excess body fat, poor metabolic control, and lack of movement. This inflammation sensitizes nerve endings around joints, making discomfort more noticeable. Importantly, inflammation does not always present as obvious swelling. It can exist as subtle stiffness and reduced mobility. Weight distribution changes also matter. Small increases in abdominal fat shift posture forward, altering spinal alignment and hip mechanics. This shift increases strain on knees and lower back. Many people reduce movement when discomfort appears, but reduced movement often worsens the problem. Joints rely on movement to circulate synovial fluid, which lubricates cartilage and delivers nutrients. Without motion, joints become drier and stiffer. The key realization is this: most joint discomfort after 40 is not immediate degeneration. It is reduced support, reduced mobility, reduced recovery, and increased inflammation. These are dynamic systems. They respond to lifestyle signals. When the body receives consistent strength training, proper nutrition, adequate hydration, restorative sleep, and regular mobility work, joint health often improves significantly. In the next part, we will look at the specific daily strategies that rebuild structural support, reduce inflammation, and protect joints long-term without extreme routines. Rebuilding joint health after 40 requires a shift in mindset. Instead of avoiding movement, the goal is to restore intelligent movement. The first pillar is progressive strength training. Strength training is not about lifting the heaviest weight possible. It is about gradually rebuilding the muscles that stabilize joints. When muscles surrounding the knees, hips, shoulders, and spine become stronger, they absorb more force and protect cartilage surfaces. For the knees, strengthening the quadriceps, hamstrings, and glute muscles reduces compressive stress. For the shoulders, strengthening the rotator cuff and upper back muscles improves joint alignment. For the spine, strengthening the core muscles distributes load more evenly. Controlled resistance exercises performed 2 to 3 times per week can dramatically improve joint stability over time. The second pillar is mobility and range of motion training. Joints are designed to move through specific patterns. When those patterns are not used, the body loses access to them. Gentle mobility routines, including controlled joint rotations, slow dynamic stretching, and posture correction exercises, restore movement pathways. This increases synovial fluid circulation and improves cartilage nutrition. Mobility work does not need to be extreme. It needs to be consistent. Even 10 to 15 minutes daily can maintain elasticity in connective tissues. The third pillar is anti-inflammatory nutrition. Chronic inflammation increases joint sensitivity. Diets rich in omega-3 fatty acids, colorful vegetables, berries, nuts, seeds, and adequate protein provide building blocks for tissue repair and reduce inflammatory signaling. Reducing ultra-processed foods, excessive sugar, and trans fats lower systemic inflammation. Adequate protein intake is especially important because collagen repair depends on amino acids. The fourth pillar is hydration. Cartilage contains a high percentage of water. When hydration levels drop, joint cushioning becomes less effective. Consistent fluid intake throughout the day supports lubrication and nutrient transport within joint structures. The fifth pillar is sleep optimization. Deep sleep supports growth hormone release, which assists in tissue repair. Establishing a consistent bedtime routine, reducing evening light exposure, and limiting late-night stimulation enhance restorative sleep. The sixth pillar is stress reduction. Chronic stress elevates cortisol, which contributes to inflammatory processes and slows tissue healing. Small daily relaxation practices, such as slow breathing, quiet walks, stretching sessions, or limiting digital overload help regulate stress chemistry. The seventh pillar is maintaining healthy body composition. Even modest reductions in excess abdominal fat reduce load on weight-bearing joints. However, rapid crash dieting should be avoided because it often accelerates muscle loss, weakening joint support. Sustainable lifestyle adjustments are more protective long-term. The eighth pillar is movement frequency. Joints benefit from regular low-impact movement throughout the day. Walking, light cycling, swimming, and standing breaks counteract prolonged sitting. Movement increases circulation and distributes synovial fluid evenly across joint surfaces. Importantly, pain-free range is the goal. Sharp pain is a signal to adjust movement, not abandon it entirely. The final principle is patience. Joint tissue adapts more slowly than muscle. Improvements in stability, mobility, and comfort may take weeks or months, But consistent signals lead to meaningful change. After 40, joint protection is not about eliminating every ache immediately. It is about building resilience so that joints remain functional for decades. Mobility supports independence. Independence supports longevity. When strength, mobility, nutrition, hydration, sleep, stress management, and consistent movement are combined, the body often responds with improved comfort and greater range of motion. Protecting joints is one of the most practical investments in long-term quality of life.